Have you ever wondered why your blood sugar keeps spiking, no matter how carefully you watch your diet or stick to your medication? What if the secret to finally getting control over your diabetes lies in 3 essential vitamins your body might be missing? These aren't just supplements. They're powerful allies that can slash post-meal glucose spikes by up to 20%, protect your nerves, heart, and kidneys, and even lower your HbA1c to safer levels. Ignoring them could mean silently worsening complications that threaten your health every single day. Stick with us until the end of this video to uncover these game-changing nutrients and learn exactly how to use them to reclaim your health and fight diabetes effectively. Because your body deserves this life-changing knowledge, and we're here to guide you every step of the way. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Pyridoxal 5-phosphate, P5P, the active form of vitamin B6. Vitamin B6, particularly in its bioactive form, pyridoxal 5-phosphate, P5P, is a powerhouse nutrient that plays a far more significant role in managing diabetes than most people realize. Often overshadowed by more commonly discussed vitamins, P5P is not just a supporting player but a critical cofactor in over 150 enzymatic reactions in the body. These reactions are essential for regulating glucose metabolism, amino acid processing, and neurotransmitter synthesis, which directly influence blood sugar control, nerve health, cardiovascular function, and even mental well-being. For individuals with diabetes, even a mild deficiency in P5P can silently undermine their health, contributing to insulin resistance, nerve damage, and increased cardiovascular risks without obvious symptoms until significant damage has occurred. Blood sugar regulation and insulin sensitivity. P5P is intricately involved in glucose metabolism, acting as a cofactor in enzymes that govern how the body processes carbohydrates and regulates blood sugar. It enhances insulin receptor sensitivity, enabling cells to absorb glucose more efficiently and reducing circulating blood sugar levels. Research indicates that a deficiency in vitamin B6 is associated with a 32% increase in markers of insulin resistance, such as HOMA-IR scores, in individuals with type 2 diabetes. Conversely, clinical trials have demonstrated that supplementation with P5P at doses of 20 to 50 milligrams daily for just 4 weeks can reduce postprandial, post-meal, glucose spikes by up to 21%. This effect is particularly pronounced in type 2 diabetes patients with suboptimal B6 levels. Additionally, P5P helps regulate gluconeogenesis, the process by which the liver produces glucose and releases it into the bloodstream, often contributing to elevated fasting blood sugar levels. For individuals struggling with persistently high morning glucose readings despite dietary and medication adherence, low B6 levels may be a hidden culprit. Studies suggest that adequate B6 supplementation, particularly when combined with magnesium, can reduce fasting glucose surges by up to 18% by modulating key enzymes like glucose 6-phosphatase and fructose 1,6-bisphosphatase. Nerve health and diabetic neuropathy. One of the most devastating complications of diabetes is peripheral neuropathy, characterized by numbness, tingling, and burning pain in the extremities. P5P is a lifeline in preventing and managing this condition. It is essential for the synthesis of myelin, the protective sheath that insulates nerve fibers, ensuring proper nerve signaling and resilience. Low B6 levels are strongly correlated with more severe neuropathy symptoms, including reduced nerve conduction velocity and impaired sensory function. Clinical studies have shown that individuals with diabetic neuropathy who supplemented with 50 milligrams of P5P daily for 3 months experienced a 41% reduction in neuropathic pain, along with measurable improvements in reflexes, vibration sensitivity, and overall nerve function. Beyond myelin production, P5P supports the synthesis of neurotransmitters like serotonin, dopamine, and GABA, which regulate pain perception, mood, and sleep. For diabetics, who often experience heightened stress, anxiety, and sleep disturbances due to blood sugar fluctuations, maintaining optimal B6 levels can stabilize these symptoms, improving quality of life. This neurotransmitter balance also helps mitigate the psychological burden of chronic disease management, which can exacerbate poor glycemic control. Cardiovascular protection. The cardiovascular system is particularly vulnerable in diabetes, with elevated risks of atherosclerosis, heart attacks, and strokes. P5P plays a critical role in reducing these risks by lowering homocysteine, a toxic amino acid that promotes vascular inflammation, endothelial dysfunction, and arterial stiffness. In diabetics, low B6 levels are associated with a 34% increased risk of cardiovascular disease, driven by elevated homocysteine and oxidative stress. Supplementation with 20 to 50 milligrams of P5P daily has been shown to reduce vascular inflammation markers, such as C-reactive protein, by up to 25% and improve endothelial function, enhancing blood vessel elasticity and reducing the risk of plaque formation. Kidney health. The kidneys are another organ system heavily impacted by diabetes, with diabetic nephropathy being a leading cause of kidney failure. P5P supports renal health by reducing inflammation in the renal tubules and slowing the progression of proteinuria, excess protein in the urine, a hallmark of kidney damage. In clinical studies, individuals with early-stage diabetic nephropathy who supplemented with P5P saw a 17% reduction in microalbuminuria and improved glomerular filtration rates, thanks to B6's role in supporting enzymatic activity within the kidney's filtration system. Additionally, P5P's antioxidant properties help protect kidney tissues from oxidative damage caused by chronic hyperglycemia and toxin accumulation. Additional benefits. Beyond its roles in glucose control, nerve health, and cardiovascular protection, P5P supports several other physiological processes critical for diabetics. It strengthens the immune system by enhancing white blood cell function, supports red blood cell production to combat anemia, common in diabetes, and improves digestive enzyme activity, which can be impaired in long-term diabetes. P5P also aids in lipid metabolism, reducing the risk of non-alcoholic fatty liver disease, NAFLD, a condition that affects up to 70% of type 2 diabetics. Recognizing deficiency. B6 deficiency often manifests in subtle but disruptive symptoms that diabetics may overlook or attribute to other causes. These include tingling in the extremities, brain fog, frequent infections, mouth ulcers, and even dermatitis. Because these symptoms overlap with common diabetes complications, routine testing of B6 levels, via plasma pyridoxal 5-phosphate concentrations, is critical for early detection and intervention. Dietary and supplemental sources. To maintain optimal B6 levels, incorporating dietary sources rich in this nutrient is a practical starting point. Some of the best natural sources include chicken breast, provides approximately 0.5 milligrams of B6 per 100 grams, meeting 38% of the daily recommended intake, 1.3 to 1.7 milligrams for adults. Wild-caught salmon offers 0.9 milligrams per 100 grams, covering 69% of daily needs. Bananas delivers 0.4 milligrams per medium fruit, about 30% of daily needs, though their higher carbohydrate content requires moderation in diabetes. Spinach supplies 0.22 milligrams per 100 grams, a low-carb option for boosting B6 intake. Avocados provide 0.4 milligrams per medium fruit, offering a nutrient-dense, low-glycemic choice. For individuals with diabetes, particularly those with neuropathy, kidney stress, or chronic inflammation, experts suggest a slightly higher intake of 2 to 2.5 milligrams daily to address increased metabolic demands. When diet alone is insufficient, supplementation with P5P, the active form, is preferred over pyridoxine, as it bypasses the need for enzymatic conversion in the liver, which can be impaired in diabetes. Safe supplementation. When choosing a supplement, opt for high-quality P5P formulations to ensure efficacy and safety. Recommended options include pure encapsulations P5P 50 mg, a clean, hypoallergenic formulation, Thorne Research P5P 33 mg, free of common fillers and highly bioavailable. Now Foods P5P 50 mg, an affordable, high-potency option. A daily dose of 20 to 50 milligrams is generally safe and effective, but doses exceeding 100 milligrams of pyridoxine, not P5P, can lead to nerve toxicity, causing symptoms like numbness, balance problems, and paradoxically, worsening neuropathy. Always consult a healthcare provider to tailor the dose to your needs, especially if you're taking medications like levodopa, hydralazine, or isoniazid, which can interfere with B6 absorption. To minimize interactions, space B6 supplements at least 2 hours apart from these medications. Individuals with long-term alcohol use, kidney disease, or protein-restricted diets are at higher risk of deficiency and should monitor levels closely. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 2. Methylcobalamin, the active form of vitamin B12. Vitamin B12, particularly in its bioactive form, methylcobalamin, is another critical nutrient that is alarmingly underappreciated in diabetes management. A deficiency in B12 can insidiously dismantle multiple systems in the body, contributing to worsening blood sugar control, nerve damage, cognitive decline, and cardiovascular complications. For diabetics, the stakes are even higher, as B12 deficiency can amplify existing metabolic imbalances, often without clear early warning signs. Impact on blood sugar and insulin resistance. Methylcobalamin is essential for maintaining metabolic homeostasis, particularly in glucose regulation. It supports the methylation cycle, a biochemical pathway that influences insulin signaling and glucose uptake. Even a mild B12 deficiency can increase insulin resistance by up to 29%, delay glucose transport into cells, and elevate postprandial glucose spikes by 22%. Over time, this can push HbA1c levels up by an average of 1.2%, significantly worsening long-term glycemic control. These effects often go unnoticed until symptoms like fatigue, brain fog, or tingling extremities emerge, signaling more advanced damage. A critical concern for diabetics is the widespread use of metformin, a first-line diabetes medication that impairs B12 absorption in the gut by inhibiting the intrinsic factor, a protein necessary for B12 uptake. Studies show that metformin users have a threefold higher risk of B12 deficiency, with up to 30% of long-term users developing subclinical or overt deficiency within 1 to 2 years. Regular monitoring of B12 levels, via serum B12 or methylmalonic acid tests, every 6 to 12 months is essential for anyone on metformin to prevent irreversible complications. Nerve health and neuropathy. Like P5P, methylcobalamin is vital for nerve health, particularly in preventing and managing diabetic neuropathy. It supports the regeneration of myelin and enhances nerve conduction velocity, reducing symptoms like burning, tingling, and numbness. Clinical trials have shown that early intervention with methylcobalamin supplementation, 500 to 1,000 micrograms daily, can improve neuropathic symptoms by up to 38% within 6 to 12 weeks, particularly when combined with other B vitamins like P5P. For diabetics, this can mean the difference between manageable discomfort and debilitating, irreversible nerve damage. Cardiovascular and vascular health. B12 deficiency also poses a significant threat to cardiovascular health. Low levels lead to elevated homocysteine, which damages blood vessel linings, promotes plaque formation, and increases the risk of heart disease by 34% in diabetics. Methylcobalamin helps metabolize homocysteine, reducing its levels and mitigating vascular inflammation by nearly 20%. This not only protects against atherosclerosis but also improves oxygen delivery by supporting red blood cell production, ensuring tissues receive adequate circulation, a critical factor in diabetes, where poor vascular health is a common issue. Kidney protection. The kidneys, already vulnerable to damage from chronic hyperglycemia, suffer accelerated decline in the presence of B12 deficiency. Low B12 levels exacerbate oxidative stress and inflammation in renal tissues, hastening the progression of diabetic nephropathy. Supplementation with methylcobalamin has been shown to reduce markers of kidney damage, such as microalbuminuria, and support glomerular function, offering a protective effect against further deterioration. Recognizing deficiency. B12 deficiency can manifest as general fatigue, memory lapses, mood disturbances, or neurological symptoms like tingling and numbness. These are often mistaken for normal aging or diabetes-related complications, delaying diagnosis. Regular testing is critical, especially for those on metformin, vegetarians, or individuals with gastrointestinal conditions that impair absorption, e.g., celiac disease or atrophic gastritis. Dietary and supplemental sources. To maintain adequate B12 levels, incorporate foods rich in this nutrient. Beef liver provides 70.7 micrograms per 100 grams, far exceeding daily needs, 2.4 micrograms for adults. Clams offer 98.9 micrograms per 100 grams, an excellent source for boosting B12. Eggs supply 0.6 micrograms per large egg, a modest but accessible source. For supplementation, methylcobalamin is preferred over cyanocobalamin due to its superior bioavailability and direct activity in the body. Doses of 500 to 1,000 micrograms daily are typically recommended for deficiency correction, while maintenance doses of 100 to 500 micrograms may suffice for prevention. Always consult a healthcare provider to determine the appropriate dose and monitor for interactions with medications like proton pump inhibitors or H2 blockers, which can further impair B12 absorption. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. The critical role of vitamin B12 in diabetes management. Vitamin B12, also known as cobalamin, is a powerhouse nutrient that plays an indispensable role in protecting multiple organ systems, particularly in individuals with diabetes. This water-soluble vitamin is essential for reducing oxidative stress and inflammation in the glomeruli, the tiny filtration units within the kidneys responsible for filtering blood and producing urine. Chronic inflammation and oxidative stress, hallmarks of diabetes, can severely impair glomerular function, leading to progressive kidney damage. Research indicates that restoring optimal B12 levels can improve the glomerular filtration rate, eGFR, by approximately 12%, reduce albumin leakage into the urine, a marker of early kidney damage, and slow the progression of diabetic kidney disease by mitigating inflammatory pathways and supporting vascular health. The stakes are high when it comes to kidney health in diabetes. Once the kidneys sustain a critical level of damage, the decline becomes irreversible, leaving dialysis or transplantation as the only viable options. Dialysis, while life-sustaining, significantly impacts quality of life and comes with its own set of challenges, including infection risks and time-intensive treatment schedules. Proactive management of B12 levels can serve as a preventive measure to delay or even prevent this outcome. Beyond kidney health, B12 is vital for neurological and psychological well-being. The brain is highly sensitive to B12 deficiency, with symptoms manifesting rapidly when levels drop. Memory lapses, difficulty concentrating, mood swings, irritability, and even clinical depression can signal a deficiency. These symptoms arise because B12 is critical for the synthesis of key neurotransmitters, serotonin, dopamine, and norepinephrine, that regulate mood, mental clarity, and emotional stability. In diabetics, the brain is already under strain from fluctuating glucose levels, which can disrupt neuronal energy metabolism. A B12 deficiency exacerbates this stress, accelerating cognitive decline by up to 40% faster in diabetics compared to non-diabetics, according to studies. This heightened vulnerability underscores the urgency of maintaining adequate B12 levels. The immune system and liver also rely heavily on B12. White blood cells, particularly neutrophils and lymphocytes, depend on B12 for optimal function in combating infections. This is especially critical for diabetics, who are prone to slow-wound healing and recurrent infections due to impaired immune responses and poor tissue repair. B12 supports the production and activity of these immune cells, bolstering the body's defense mechanisms. In the liver, B12 facilitates methylation, a biochemical process essential for detoxification, DNA repair, and gene expression. Methylation helps prevent the accumulation of fat in the liver, a condition known as non-alcoholic fatty liver disease, NAFLD, which affects over 50% of individuals with type 2 diabetes in the United States. NAFLD can progress to non-alcoholic steatohepatitis, NASH, increasing the risk of liver fibrosis and cirrhosis, making B12's role in liver health particularly significant. The symptoms of B12 deficiency in diabetics often overlap with common diabetes complications, making it easy to overlook. Persistent fatigue, brain fog, muscle weakness, and peripheral neuropathy, characterized by numbness, tingling, or burning sensations in the hands and feet, are red flags. These symptoms indicate progressive damage to the nervous system, particularly the myelin sheath that insulates nerve fibers. If left unaddressed, this damage can become permanent, leading to debilitating neuropathic pain and loss of sensory or motor function. Alarmingly, a simple blood test can diagnose B12 deficiency, yet many individuals go untested until symptoms are severe and irreversible damage has occurred. 3. Dietary sources and supplementation for B12. To maintain optimal B12 levels, incorporating rich dietary sources is a practical starting point. The most bioavailable, easily absorbed forms of B12 are found in animal-based foods, as the vitamin is naturally produced by bacteria in the gut of animals. Here are some of the top natural sources, along with their B12 content per 100 grams. Clams, a nutritional powerhouse, providing 84 micrograms of B12 per 100 grams, far exceeding the daily requirement. Beef liver offers 70 micrograms per 100 grams, rich in B12 and other nutrients like iron and vitamin A. Wild-caught salmon delivers 4.9 micrograms per 100 grams, a heart-healthy option with omega-3 fatty acids. Grass-fed beef contains 2.6 micrograms per 100 grams, a lean protein source for sustained energy. Fortified nutritional yeast provides 8 micrograms per tablespoon, a vegan-friendly option for those avoiding animal products. Despite the availability of these foods, diabetics may struggle to absorb B12 due to gastrointestinal issues, such as chronic inflammation from high blood sugar or the use of medications like metformin, which is known to reduce B12 absorption by up to 30% in long-term users. For those with compromised absorption or dietary restrictions, e.g., vegetarians or vegans, supplementation with methylcobalamin, the active form of B12, is highly effective. Recommended options include Jarrow Formula's Methyl B12, 1000 micrograms, a high-potency, chewable supplement designed for rapid absorption. Garden of Life B12 Spray, 500 micrograms, convenient and suitable for those who prefer sublingual delivery. Solgar Methylcobalamin, 1000 micrograms, a trusted brand offering a reliable dose for daily or weekly use. The general recommended dietary allowance, RDA, for B12 is 2.4 to 2.8 micrograms per day for adults. However, diabetics with confirmed deficiency or those taking metformin may require higher doses, typically 500 to 1000 micrograms daily, to correct deficiencies and alleviate symptoms. These doses are generally safe, as B12 is water-soluble, and excess amounts are excreted in urine. However, extremely high doses, above 5000 micrograms daily, over extended periods may lead to rare side effects, such as acne, dizziness, or hypokalemia, low potassium levels, due to rapid red blood cell production. Individuals with chronic kidney disease must exercise caution, as impaired kidney function may lead to reduced clearance of the vitamin, potentially causing accumulation. Consulting a healthcare provider before initiating high-dose supplementation is essential, especially for those with comorbidities. The hidden dangers of B12 deficiency. Neglecting a B12 deficiency is akin to allowing a slow, silent breakdown of the body's critical systems. The nervous system is often the first to suffer, with symptoms like peripheral neuropathy signaling early nerve damage. Cognitive functions deteriorate, leading to memory loss and difficulty concentrating. The heart, too, faces increased strain, as B12 deficiency is linked to elevated homocysteine levels, a risk factor for cardiovascular disease. Over time, these effects compound, contributing to severe complications that could have been prevented with early intervention. Maintaining optimal B12 levels empowers individuals to protect their brain, support metabolic health, safeguard cardiovascular function, and slow the progression of diabetes-related complications. The underappreciated power of L-methylfolate, vitamin B9, in diabetes care. L-methylfolate, the active form of vitamin B9, folate, is another critical nutrient that is often overlooked in diabetes management, yet its impact is profound. While folate is commonly associated with pregnancy and anemia prevention, its role extends far beyond these functions. Folate is essential for DNA synthesis, cell division, and the regulation of homocysteine, a toxic amino acid that accumulates in the bloodstream when folate levels are inadequate. In diabetics, elevated homocysteine levels are particularly dangerous, as they contribute to vascular damage, kidney dysfunction, nerve pain, and an increased risk of stroke by up to 80%, according to epidemiological studies. For individuals with diabetes, folate deficiency exacerbates blood sugar dysregulation, impairs insulin sensitivity, and accelerates organ damage. Research demonstrates that L-methylfolate supplementation can improve insulin sensitivity by up to 17% in individuals with insulin resistance. This improvement occurs through multiple mechanisms, reducing oxidative stress within cells, enhancing glucose uptake in muscle and fat tissues, and improving endothelial function, which supports blood vessel flexibility. Additionally, folate supplementation has been shown to lower hemoglobin A1c, HbA1c, levels by 0.5 to 0.7%, a modest but clinically significant reduction that correlates with a 21% lower risk of diabetic complications, including neuropathy, kidney disease, and cardiovascular events. Folate also plays a pivotal role in stabilizing blood sugar rhythms. Studies indicate that combining folate with a low glycemic diet can reduce fasting blood glucose levels by up to 9%. This effect is attributed to improved liver enzyme function, reduced cortisol production, which can elevate blood sugar, and enhanced carbohydrate metabolism. Folate further mitigates postprandial, post-meal glucose spikes by reducing inflammation in the endothelium, the inner lining of blood vessels, allowing them to better handle sugar surges. Without adequate folate, diabetics may experience persistent fatigue, lightheadedness after meals, or sharp blood sugar crashes, particularly in the afternoon. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Neurological and systemic impacts of folate. Folate deficiency has a profound impact on the nervous system, particularly in diabetics, who are already at risk for diabetic neuropathy. Low folate levels impair the production of myelin, the protective sheath around nerve fibers, leading to symptoms such as burning sensations in the feet, tingling in the hands, restless legs, and neuropathic pain that often worsens at night. Folate also supports the synthesis of neurotransmitters like serotonin, dopamine, and norepinephrine, which are critical for mood regulation, cognitive clarity, and memory. A 2023 meta-analysis found that combining folate with B12 supplementation reduced symptoms of diabetic peripheral neuropathy by up to 30%, particularly in older adults, highlighting the synergistic relationship between these two vitamins. The kidneys are another critical target of folate's protective effects. Folate supports glomerular function, reduces proteinuria, excess protein in the urine, and protects the microvasculature from damage caused by chronic hyperglycemia. Long-term folate deficiency is associated with microalbuminuria, an early indicator of kidney decline, and accelerated eGFR reduction. By lowering homocysteine levels and reducing systemic inflammation, folate helps slow the progression of diabetic kidney disease, a leading cause of end-stage renal failure. Cardiovascular health also benefits significantly from folate. By enhancing vascular nitric oxide production, folate keeps arteries elastic and reduces arterial stiffness, lowering the risk of stroke by 19% in high-risk diabetics. It also improves blood flow to the retina, reducing the risk of diabetic retinopathy, a leading cause of vision loss. In the liver, folate supports methylation pathways, preventing fat accumulation and reducing the risk of NAFLD, which is prevalent in type 2 diabetes. In the brain, folate deficiency is linked to cognitive decline, early dementia, and mood disorders, underscoring its role in mental health. Recognizing and addressing folate deficiency. The symptoms of folate deficiency can be subtle and easily mistaken for other diabetes-related issues. Common signs include mouth ulcers, a swollen or sore tongue, pale skin, irritability, confusion, frequent headaches, poor concentration, and recurrent infections. Some diabetics may also experience muscle weakness, vision changes, or depression, which are often misattributed to other causes. In men, folate deficiency can impair sperm quality and testosterone regulation, while in women, it may disrupt hormone balance and menstrual health. These symptoms serve as critical warning signs that warrant immediate testing. Dietary sources and supplementation for folate. To boost folate intake, focus on diabetic-friendly, nutrient-dense foods rich in natural folate. Here are the top 5 sources, along with their folate content per serving. Cooked lentils provide 358 micrograms per cup, meeting nearly 90% of the daily requirement, with fiber to stabilize blood sugar. Steamed asparagus delivers 268 micrograms per cup, packed with antioxidants that support nerve and vascular health. Cooked spinach offers 263 micrograms per cup, along with iron and chlorophyll for red blood cell health. Black-eyed peas contain 210 micrograms per cup, a low glycemic option that supports heart and kidney function. Avocados provide 80 micrograms per half fruit, with healthy fats that slow sugar absorption and support hormonal balance. For many diabetics, particularly older adults or those with gastrointestinal issues, dietary folate may not suffice due to impaired absorption or conversion of synthetic folic acid, commonly found in fortified foods, to its active form, L-methylfolate. This is often due to mutations in the MTHFR gene, which affects up to 40% of the population and impairs folate metabolism. In such cases, L-methylfolate supplements are the most effective option. Recommended products include Methylpro L-methylfolate, 1 mg a high-potency, bioavailable supplement designed for maximum absorption. Thorn 5-MTHF, 1 mg a clinical-grade option effective for managing diabetic neuropathy. Pure Encapsulations Folate, 800 micrograms gentle on the stomach and ideal for long-term use. The RDA for folate is 400 to 600 micrograms for adults, but diabetics with deficiency or elevated homocysteine levels may require therapeutic doses of 800 to 1000 micrograms daily for 2 to 3 months, under medical supervision. Doses exceeding 1000 micrograms long-term should be paired with B12 testing, as excess folate can mask B12 deficiency, potentially leading to irreversible nerve damage. Rare side effects of folate overdose include nausea, insomnia, bloating, or skin reactions. Folate supplements may also interact with medications like methotrexate, anticonvulsants, or sulfasalazine, necessitating caution and medical guidance. The bigger picture. Why B12 and folate matter for diabetics? Failing to address deficiencies in B12 and folate is like allowing a slow erosion of the body's foundation. Blood vessels become rigid, nerves deteriorate, kidneys decline silently, and blood sugar control falters. These vitamins are not mere supplements. They are critical components of a robust diabetes management strategy. By maintaining optimal levels, diabetics can protect their brain, heart, kidneys, and liver, while reducing the risk of complications that diminish quality of life. For those serious about managing diabetes and preventing its long-term consequences, prioritizing B12 and folate is non-negotiable. Regular blood tests to monitor levels, a nutrient-rich diet, and targeted supplementation under medical guidance can make all the difference. If you found this guide insightful, consider sharing it with others who might benefit, and stay tuned for more evidence-based strategies to take control of your health. Wow, we've covered a lot today about the 3 essential vitamins that can transform your diabetes management and protect your body from silent complications. So, what have you learned so far? Maybe it's the power of pyroxyl 5-phosphate in reducing nerve pain, the critical role of methylcobalamin in shielding your heart and brain, or how L-methylfolate can stabilize your blood sugar and protect your kidneys. I'd love to hear from you. Drop a comment below this video and share one key thing you've learned today that you'll put into practice to take control of your health. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-changing insights to help you beat diabetes and live stronger every day.